Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. Today, we have a very special guest with us. We have with us Dr. Rahul Damania, who is a pediatric critical care doctor and also the founder of Hyguru, which is a rising platform for medical education. An amazing educator. He has helped me so much personally for my step one exam. I found the channel very late and I kind of regret that. I wish I had found it sooner because it was something that really clarified my concepts with certain things that you find difficult. And it was just amazing. And the way he teaches is amazing. I'm so glad to have him here with us today. Thank you so much for coming here. I'm so excited. And it's such an honor to be talking to you from the same place that you actually record your videos, which is so cool. And it's amazing. Thank you so much for coming here.
Anushay, this is super exciting. I am very grateful, excited to dive into some questions and connect with your audience as well.
Thank you so much. We usually start off with what your early life was like. What was something that inspired you to pursue pediatrics as a specialty and then move on in your career as a medical educator?
Yes, I think that the journey has been so fulfilling. And when it comes to my early life, I grew up in a small suburb of Cincinnati, Ohio. My parents are both in healthcare. My mom is a dentist. My dad is working for a big healthcare company, Johnson and Johnson. And my aunts and uncles, I was kind of surrounded all by physicians. And that really was the right nurture for me as I developed through my primary school and beyond. I was fortunate to get an admission to a 6-year combined BSMD program, which is where you do a slightly untraditional route, 2 years of undergrad rather than the traditional 4 years. And then you directly go into medical school, which is 4 years. After that, I started to explore fields. And there was one moment that really made me choose pediatrics, and in particular, the subspecialty that I'm in, which is pediatric critical care. And during my second year, right around my USMLE preparation for step one, my sister unfortunately had a very traumatic accident in terms of having a interventricular bleed, and she was very sick in the pediatric ICU, and she was there for so long, and I was trying to balance my medical training and medical school and step one exam at that time. Now, thankfully, she is doing phenomenal now. However, that was such a formative moment for me because that was the first time that I was truly on the patient side. And so now it comes such full circle after residency and fellowship that I have had the unfortunate, but also very empowering experience of being on the patient side. And I can really empathize and connect with some of the families that come into our pediatric ICU. As you go through pediatrics, one of the most natural things that you end up becoming is a teacher. And what I mean by that is throughout medical school, we learn a very different language, and that language has so many complexities, intricacies, nuances. However, your job as a pediatrician is to really translate that to, let's say, a young adolescent or a school-age child, or even the family of an infant. And so I found that so empowering, and that challenge really continues to drive me. And that was really the nidus to say, I love pediatrics. When you're a pediatrician, you have to be a natural educator. And then now, how can I hone that in a creative manner? And that's where I started focusing on high stakes examination, which includes NBME, USMLE exams.
Actually, a great way to look at it. I've never thought of it that way, that once you're a pediatrician, you are going to be a very good teacher. But it's great that you actually thought about your specialty so much and you experienced all of that. So now you can empathize greatly with patients who are in that situation. That's amazing. That's honestly so inspiring.
Thank you.
So you got done with your fellowship and you were practicing as a pediatrician. But why did you move on to making a platform like Hyguru and moving on to YouTube and honestly doing it so well?
Oh, that is such a great question. And I think that some of those underpinnings start as early as medical school. I was always one of those medical students who would be teaching my juniors, whether it's in the back of the library or just like talking in casual conversation. And I was really driven by taking very complicated topics and a large amount of information, picking out what is testable and understanding how it may be asked on the actual exam. And that those casual conversations and mini chalk talks really stemmed a true passion for teaching medicine in a very unique way. And
Yeah.
traditionally, medicine has been always taught in a linear manner. And what I mean by
Yeah.
that is at times in those days, this is talking in the 2010s era, medicine was kind of thought of as sage on the stage. In fact, some of your lectures may still be sage on the stage, where you have a
Yeah.
traditional lecturer who is an amazing expert in the field, however, just has many PowerPoints that are just talking about things in a very logical, linear, maybe even monotonous manner. And so I said, let me try to flip the classroom and let me try to tackle some content and material where all medical students can relate. And that is definitely the USMLE. I think that USMLE is such a fascinating, exciting exam, though it is stressful, but it is that unifying thread that if I saw you all the way from Pakistan and you came here, we could connect on the stressors and the joy that we had learning and going through that exam. And so in my 4th year of medical school, we had the opportunity to take some electives. And one of the electives that I wanted to take was more so like a research or studying elective. Honestly, it was just probably a really good excuse for me to go travel the world and do some things on the side. But I started becoming very intrigued by having the opportunity to teach not just one-on-one, but actually large audiences. So I went to my school and I asked them, is there a opportunity for me to lecture students and teach in a way that's more based on active recall, synthesizing all of the stuff that they have already learned in their coursework? And that was probably one of the first moments that I was empowered to say, oh my gosh, I should actually make this into something big. They said that my medical school said, yeah, here is a classroom, but the classroom is 1 hour away. And it is kind of in the colder months of Cleveland weather where it's snow, etc. And so now here I was, I got the opportunity. I have a classroom. I have great tech in that classroom in terms of cameras and in terms of the ability to share PowerPoint slides and whatnot. But now I had to get students to actually take 2 hours of their studying and go from a suburb of Cleveland all the way to downtown Cleveland, which is about a 45-minute drive. And so that was a challenge in and of itself. And so that really made me think, how do I attract these students? And I said, this is going to be a vignette oriented review. This is going to really take all of the highest yield material. We're going to be focusing on testing your knowledge, honing in your knowledge, understanding how to make links between concepts. And at that time, I want to credit my wife definitely, because she even told some of her friends to go and attend these review sessions. And they were held on a Saturday covering one organ system. I lectured for 6 hours and we had a classroom full of students. And that made me so grateful. I continued that through residency. I still remember signing out at 6 p.m. for my pediatric wards and then going to the med school and hosting these review sessions, 3 hours, 6:30 to 9:30, and having a classroom full. And all of those things were super humbling, to the point where then I said, let's go ahead and formalize this. And my co-founder, David Shaffrin, and I had a conversation when I was a first-year resident. And at that time, David Shaffrin was just an assigned mentor for me. He ended up being the co-founder of Hyguru with me. But the program delineated this pediatric nephrologist named David Shaffrin as my mentor. And so when he became my mentor, I still remember being in the cafeteria of our pediatric hospital. And he, at that time, was the medical director for the physician assistant program. And what he would say is, he would say, oh, Rahul, it looks like you're a rising medical student and resident interested about teaching physiology. You would be a great faculty member for our physician assistant program. And I said, awesome. Yeah, I love it. I'm going to go ahead and do that. But then he saw my slides and he said, oh my gosh, you're teaching all these questions. You're teaching more vignette style. You're teaching mechanisms of disease. You have different flow diagrams, Venn diagrams. Just turn this into something that can be disseminated and, frankly, a business that can create impact, but also, as a resident, create some, side income. And there's, nothing wrong with that. It's just one of those unique things that you think about. And the journey just got started there. And I have had many ups and downs, but very, very grateful to now transition it not only in person, but also digitally, leveraging social media. And here we are today.
This is such a cool way, like how you started and then started off with people in Cleveland and students there and getting students to come on a Saturday so far away from the actual hospital and staying there for so long. You must be doing something right. And we know what it was because I have studied through that, and a lot of people have studied through it. And your YouTube channel is just growing and growing and growing. And Hyguru itself, the platform is growing so much. So it's amazing, and amazing that you've reached people all over the world and not only in a particular medical school. What are some of the ups and downs that you faced?
Absolutely. I am very grateful for the blessings from God above and also my support system. Without that, nothing would be possible. And I really appreciate your kind words as well. I always centered myself on this quote, and that is that the definition of grit is going from challenge to challenge without losing enthusiasm. And why I say that is initially in the early days of High Guru, the challenge was primarily technical. And what that technical challenge was how do I annotate something on a screen? I was buying so many random gadgets, gizmos. Some of them would work, some of them wouldn't. And not only do you want to figure out the technology of drawing on the screen on a PowerPoint, but you want to do it well. You want to do it synced with your content. How do you edit videos? I mean, these were things that I had to really understand and know. The other challenge was, how do I keep all of this very lean? You know, it's so easy to be like, oh yeah, just go ahead and hire it. But to pay somebody $400, $500 for one lecture, I mean, I had the whole USMLE syllabus to go through. So that was also a big challenge. And, you know, along with that challenge came the true difficulty of trying to set yourself apart. Because in those days, you know, other very awesome companies like Pathoma, Sketchy, all of them, Boards and Beyond, were rising to the top. And here I was as a scrawny resident, honestly, that just had a passion for honestly teaching. And so differentiating myself as somebody who is going to be focused more on integration, somebody who is going to be more focused on test taking strategies, somebody that is going to really help you draw connections to the vignette. These were things that I really confident in. And sometimes that confidence aspect, that internal confidence, is a challenge in and of itself. And so that is kind of a snapshot of some of the difficulties that I had early on with Hyguru.
Actually, very true, because how you set yourself apart was that your videos were focused more on the reviewing part, which was something that was missing in the picture, because there are a lot of videos for a particular topic, but you don't have a video that is reviewing the important things and telling you that this is how the question is going to show up on the exam, which is very important because at the end of the day, you obviously have to become a very good clinician, but you also need to pass your exams. And I don't think anyone else was focusing on that. And I think that's one of the reasons that Hyguru connected so much with students and connected so much with me personally. Because I remember doing my first NBME, and I knew all of the information, I knew everything, but still, like, there was something that was missing, there was something that I needed to know. And then I found the video for the reproductive module chapter for Hi Guru, the review video on YouTube, and it changed my understanding of things. And I have an entire notebook of notes from all of your review videos.
Oh,
So I'm
wow.
it was really helpful. It was something that really helped me.
That's very helpful. And that has been one of my guiding principles is, you know, we classically think of USMLE preparation as having content review and then question banks or question review. And so my goal was to mesh them both together. And so I kind of think about my lecture, especially when I make my lecture, as a guided Anki deck. I may not be a good resource for just like one particular topic, but if you look at the whole system of cardiology, I'll be able to put the concepts together so that that can build some long-term retention. And I've really valued the fact that you can do questions and content at the same time and stay at the edge of your seat. I think why that has become very effective, and I'll give a personal example, is during my third year clerkship, all of us go through these clinical rotations. And I probably can, or you probably can think about a attending or a senior consultant asking you one specific PIMP question about a disease. Hey, what is the mechanism of why that works, et cetera?
Yeah.
during that time, any student, myself included, we have
Yeah.
this emotional response. And these emotional responses could be something like confidence. I do know that answer. Or something like, oh my gosh, I don't know what that answer is. And that kind of little bit of trepidation or being a little bit
Yeah.
scared or unsure. And so I found that whenever you take emotion and you pair it with content, for example, you never forget that pimp question now. When you take an emotion and you pair it with content, there is where learning happens. And so that's why many of my lectures, a student is on the edge of their seat being like, do I know this? Do I not? Do I know this? Do I not? Eliciting those emotions and then pairing it with the high yield content.
Yeah, that's so true. And that's a great way of looking at it. Whenever a consultant has asked me a question and I get this emotional response, maybe if they ask about a gene, like what is the exact gene, and then I start thinking, or if I know it and I get excited, I think that stays with you. And even while watching the review videos with Hyguru, because you do ask in your videos, you give some time in between to think about it as well. When you get the answer right, it's actually so amazing and so gratifying.
And application is so important when it comes to medicine in general. We can really think about medicine as the content not being that challenging. Actually, the content itself, once you look at a concept, it's pretty digestible. But what is challenging in medicine is the breadth of content that there is and the pace at which you need to know the content. For example,
Yeah.
medical school, it's like, okay, 4 weeks of cardiology, 2 weeks of psychiatry, you're just boom. It's the pace that makes the plethora of information very challenging to get towards. And, going back to what we were talking about in terms of challenges, one of the challenges that started to arise is that there were some faculty or other people that were saying, oh, Rahul just teaches board stuff, not medicine stuff. And I said, no, listen, these clinical vignettes are just like patients. In fact, many of these board questions are actually derived from patients. However, they are going to be more in an objective lens because the goal of these NBME and USMLE exams is to assess your knowledge on a core base of science. And so what I really want to emphasize here is that adage of, well, there's the board question answer and there's what we do clinically. I would actually break that thought process. And why I say that is because clinical medicine is full of complexity. Clinical medicine is full of subjectivity in terms of there are social determinants of health. There are different physiologic states and reserves of patients that makes one treatment better than the other. But there are guiding principles that actually are going to build your management framework in the clinical sense. And I genuinely believe that optimal performance on USMLE Step 1 and Step 2 CK can be such a strong foundation for you to then go into residency and fellowship and understand different variations of illness scripts that you have honed in very well on Step 1 and Step 2.
At the end of the day, the concepts and the foundation that you have, you build upon that. If your foundation and if your concepts are not strong enough, then it will be difficult to build on that and look at the different variants of diseases that do show up clinically. So yeah, that's very important. Yeah.
Yeah. And I think that it should be not a psychological lens of overwhelm, but a psychological lens of being inspired. We are tasked as pediatric intensivists or whatever field, but myself particularly, we are tasked to make such challenging decisions. And no matter what field you go into, you are going to be a leader no matter what. And the point being here is that as you are going to become a well established physician, you want to recognize that these challenges, such as, for example, USMLE, are there to really get you to that next level of critical thinking. They should inspire you. It should be challenging. Why should it be challenging? Because we are, at the end of the day, we are dealing with people's lives. At the end of the day, I always say that is somebody's child. That is somebody's brother. That is somebody's sister. We really need to center ourselves on that. And hopefully, and I try to inspire this through my lectures and all of my social media content, that the guiding light is that at the end of the day, you're building these core foundational skills, not to just be like, oh, Krebs cycle and then forget about it, but actually get to a level of thinking like a physician, thinking in such a robust manner, such that at 2 a.m., you can make that influence at the bedside. And also the breadth of content specifications that need to be tested in order to certify you as a competent physician. And I also think that with regards to USMLE preparation and even going through residency and fellowship, it's more important than ever to have a solid support system, both internally and externally. And I think that during those very stressful times of preparing for an exam or going through residency and fellowship, sometimes those support systems or even basic tenets like good nutrition, good sleep, good exercise are actually lost. And I had to learn the hard way for sure in terms of really looking at those as fuels, as gas, as a kind of tea in the cup, such that then I can put my full concentration on studying. And so I really would encourage people to focus on their own wellness and the support system surrounding them, the relationships, so that then you can, like you were saying, last those 8 hours, 16 hours, even 24 hours on those shifts and in those exams.
Yeah, definitely. And I remember watching a video that you have posted on your channel because I was in my dedicated studying period at that time. Obviously, when you take a break, you open Instagram and you're just scrolling through reels mindlessly. And there was this video where you said that when you take a break, make it mindful and actually do things that you realize by the end of your break that you did something that was calming to your mind rather than just being on a sensory overload and watching reels constantly.
No, absolutely. What I have found very effective when I'm preparing for any board exam or just needing to do a lot of work is having a no tech 15-minute break. And I still remember in my dedicated study for USMLE, I would take many long walks, now weather permitting, but I would take so many long walks and I would not have my phone. I wouldn't even have any audiobook or anything like that. I would just be in my own thoughts. And one of the things that I kept doing during those walks is I did two very effective things. The first one is I just had a gratitude practice. I just really emotionally said, I am so grateful to have the knowledge, the energy, and the support to take this exam. And I think sometimes we can lose sight of that very important component. And the second thing that I started doing is I started reflecting on how can I just be a little bit better? What are the things that were distracting me? Why did I maybe get those questions in a row wrong? Always constantly being reflective on how you can improve can sometimes help you transcend low NBME scores or low UWorld block scores. And that is where that 15-minute, no Instagram, nothing break. I know it's very hard sometimes, but I think that it is so effective to channel both gratitude and a reflection on your performance.
Definitely. You have a very energetic and a very lively personality when you're teaching in your videos, and you're very intentional about being very active because that is something that keeps you awake. So, is that something intentional?
You're absolutely correct that it is very intentional. This is something that, I take a pause and I tell myself that either I can cover everything in a superficial manner or I can cover the most salient or high yield, most testable topics. But I take it one step further. Not only what is high yield that always shows up, like endometriosis, fibroids, etc., but what I also say is, are there concepts that are easily confused? I.e., we've all had those moments where A and E, oh my gosh, they're like, I picked the wrong one. I'm always down to two. And can I Venn diagram those? So anywhere there's compare and contrast, I say definitely let's go ahead and cover that in the lecture. The other element that I use is a process-based approach, in the sense that if there is a process that can really be a guiding or very high yield in that organ system, I like to create those flow diagrams because then you can really effectively integrate farm, micro, mechanisms of disease. You can integrate arrow questions, for example. And so that has been another way that I make a lecture. And then finally, I like to think about my lectures as the USMLE content with the clinical reasoning lens. So that's why I say words like illness script or semantic qualifiers or recognizing biases that, oh my gosh, when you see cafe au lait spots, everybody's going to knee jerk and say, oh, that's neurofibromatosis 1. Yes, maybe. But if they have precocious puberty, maybe now you're thinking that the cafe au lait spot is due to McCune-Albright syndrome. And so really recognizing what we do as physicians, we think about problem representations, illness scripts, semantic qualifiers, and check our own biases. Again, now this is a concert of not just getting good scores on the exam, but actually being a kick-ass physician.
I completely agree.
I always try to think about any content that I'm putting out, even if it's like a 30-second Instagram reel.
Yeah.
I always try to be mindful of who is my audience. And
Yeah.
when I was a student, what would I have liked to see? Or what did I find very effective from great educators and mentors who I had and continue to have? And that guiding light always being more so student focused and having that student lens really is something that excites me each day when I wake up and I say, pediatric critical care and Hyguru. And that's my identity, which is great, along with the life stuff for sure.
How do you manage all of this? Just managing residency or fellowship alone is such a big task, and then doing all of this together. How do you do this, and how do you find that balance?
Absolutely. I think I am a work in progress still. And one thing that I will say is that I'm very grateful for the support system around me and the blessings from above. I mean, my wife, my family, they're all so supportive of all of my passions. And the second thing that I will say is that a lot of what I do, both, in medicine and outside of medicine, it doesn't feel like work to me because I am just truly fueled by it and I'm fueled by the impact. I will say, and I'm not trying to paint this rosy picture, it every day is not perfect at all.
Yeah.
And I think I have become, at least recently, more mindful that those imperfections is what makes life so worth living. And so there will be days where I'm like, I do not want to wake up at 4 a.m. to do this lecture, but really driven by the fact that I've come so far and it is helping so many students. It makes me feel so whole. And I think that that has now really crept in, and I don't call it work-life balance. I just talk about living a passionate life. And yes, some days are challenging on the work side, but also some days are challenging on the life side. And having guiding principles of always wanting to improve yourself, being rooted in faith, trusting the process, and maintaining relationships, those are things that I really make sure I incorporate each and every day.
That's a great way to look at it, because we talk about work-life balance, but if we think about it, if you're actually passionate about what you do and it is so fulfilling and you're creating so much impact in lives of so many medical students across the world,
Thank
not
you.
only in the US, do you plan on expanding it more? And what are some of the features that we should look out for?
I am always thinking about this question. And one area that I am working very hard on is number one, partnering with other really talented educators. Number two, I'm increasingly fascinated by the role of artificial intelligence and large language models like ChatGPT to help us with USMLE studying. I've created some prompts that can be found on ChatGPT, USMLE.com. I partnered with a very talented medical student named Jake Portnoff, who is from Med School Bro. And we created these prompts together. And I'm so fascinated on how we can really leverage AI and use that technology to help make our studying more fruitful and more productive and efficient. And the other thing that I'm constantly going to be pushing myself to do is getting the word out and leveraging social media. Like you said, short form content is here to stay. And so I really think of it as a challenge of, oh my gosh, I have to take this concept now. And rather than a 60-minute YouTube video, to turn it into like a 35-second Instagram reel. And that is always so fun to look ahead and see how can we leverage social media to grow.
Yeah, definitely. And I think AI has made that easier as well, because you just put your 60-minute video into a website and it will create short reels for you better than you will actually make yourself, because they have these edits and these captions.
Yeah. And I want to cite a quote that I was reading in the Harvard Business Review, and that is that AI will never replace humans. But humans with AI may have the potential to replace humans without AI. And
Yeah.
so I think that medical school curricula, and this is something that we are working on here, we need to rise up to the occasion, embrace these new technologies, and understand what are the limitations of these technologies, but also how they can be complementary to our skill set and maybe even cognitively offload us so that then we drive further innovation.
Yeah, definitely. But do you have any advice for medical students?
Absolutely. I really think that three guiding principles help me from a business and just trying to get through practice and whatnot as well. And here are the three principles, and they're not all encompassing, but at least they can shed some light on some of the challenges that we all face. Doing your best may not be enough. You may have to do what it takes. And so having that lion inside of you to really push yourself to do what it takes is very important, because at times we can get those voices in our head that put our own limitations. And I always center myself on how can I continuously be comfortable with being uncomfortable. And that's the first guiding principle. Second one is just becoming 1% better each day. I really believe in the fact that tomorrow is a mystery. Yesterday was a history, but today is a gift. And that's why they call it the present. And how can you be 1% better in the present? That really helps me not take my mind to say, oh, this block means I'll get this score, and that means I
Yeah.
won't match in this. Our mind kind of has that chain of command. And what we want to do is just focus on getting 1% better. And then the third thing that I say is immerse yourself. For me, as a business owner, I say be customer obsessed, be student obsessed, be obsessed with the quality of your work. And that's where, even when you're thinking about taking extracurriculars, quality and having high output that is deep and meaningful is better than many different extracurriculars where you're just trying to pad your ERAS application. So always focus on going deep and being quality, especially with some resources. You want to hone in on just a few resources and try to master those. I think that that will really help you stay less overwhelmed.
Yeah. That's amazing advice. I think this is the best advice. I asked this question to all of the guests on this podcast, and we have almost had, I think, more than 20 episodes in the past 2 years. This is the
They're
best
great
advice.
episodes, by the way.
Thank you so much. Honor coming from you. But I think this is some of the best advice that I've gotten on this podcast, because it's so structured and so clear and so forward thinking about how you can actually improve yourself. Focusing on the bigger things is so much more important, I believe. And that's what you talked about as well. And it's amazing, honestly.
Thank you so much. And Anusha, talented medical students like you inspire me each and every day. So really like this forum, this podcast, and was really a nice conversation, and can't wait to maybe even come back and talk about another topic.
Yeah. Thank you so much. It was so nice talking to you. But this was honestly amazing. I am so honored right now. And I'm so glad that I could have this conversation with you.
No, can't wait to continue to stay in communication and connect with your listener community. I pride myself in always wanting to be student facing, because I know what it was like being a medical student. And I'm really excited and grateful for the opportunity to still be on the ground level connecting with bright medical students each and every day.